Welcome to Kaumudy Global. Since the beginning of June, COVID-19 instances have been steadily rising. With 17,000 new instances reported in the last 24 hours, the most recent statistics reveal a four-fold surge. You start to wonder if this is the beginning of a brand new devastating wave. How do we stop it if that is the case? The fundamentals of handling COVID-19 remains the same. Both immunizations and public health initiatives are still effective. There are some new treatments, but right now, out of the reach for the majority in the country. Here are the preventive measures which have been practiced for quite some time, but let's know more about these in detail. Masking, social distancing, and ventilation. COVID-19 prevention is seen to be very successful even with a cheap cotton mask. It has been demonstrated that improving indoor ventilation significantly lowers the incidence of infection. A transmission may be less likely if external air is allowed to enter. The World Health Organization recommends portable standalone air filtration units with HEPA, high-efficiency particulate air filters, which have grown in popularity in recent years due to an increase in pollution for locations where increasing outdoor ventilation is not possible due to prior building restrictions or other factors. The public's growing dissatisfaction with masking and social seclusion makes it more challenging for the government to enforce ventilation and masking all year round. When the number of cases increases, the government should be stricter with these actions. Vaccination is yet another initiative. Because they offer superior protection and can adapt quickly to a novel variety, mRNA vaccines like those produced by Pfizer and Moderna are crucial in the fight against COVID-19. Due to the negative side effects of these vaccinations, the makers and the government have not been able to resolve the liability issue, hence they are not currently available on the Indian market. Although there are domestic mRNA vaccines under various stages of licensing, it will be months before they are made available. The government must push forward for additional vaccinations and make it simpler for individuals to get immunized, given that 75% of the population has received at least one vaccination, 66% has had both immunizations, and only 3% has received the booster shot. It illustrates how far behind we are when nations like Israel, the United Kingdom, the United States, and others distribute their second boosters. This might be accomplished with the aid of a persistent awareness and education campaign and the free distribution of boosters. It is very important that we comprehend that the protection offered by the doses decreases over time and that there should be a 6-month interval between doses. Next being diagnosis, data, and modeling. The quality of data collecting upon this virus in our nation is uneven and insufficient. Genome sequencing should be performed on approximately 5% of all RT-PCR testing to determine whether any potentially dangerous mutations are present in the samples. With the use of this knowledge, we will be able to better prepare ourselves and receive an early warning in the event that a variant contains harmful mutations. To analyze all data flowing in across the nation and keep an eye out for potential outbreaks, the government should put together a team of public health specialists, disease modelers, and data analysts. Once we understand this, we may apply it to other diseases and use it to combat them. Bill Gates is promoting this concept on a global scale under the aegis of GERM, Global Epidemic Response and Mobilization Team. We need to prepare for a new disease or a spike in cases. The likelihood of a new hazard emerging is fairly significant given the increase in international travel and human-animal interaction. This is Anjana signing off. Do like and share this video. For further updates, subscribe to Kaumudy Global.